Dr. Zaibak, lately there is a little bit controversial news out there about denture cream adhesives. Too much zinc in it. People are wearing them, and apparently, it's not 100% proven, but apparently there are some nerve damages. People get tingling fingers and toes, extremities. They get numb fingers. They get muscle weaknesses, jerking emotions, and some people really have it damaged, even though the court might not have proven that it comes from those adhesives. What's your take on it, and what can be done against it?
Wow. Personally, I haven't seen any type of complaints with what we use, with our products that we use and recommend. I guess that's a very hard theory to prove, as there's many different products out there.
Right, I'm very sure it is. But remember about I think it was about 91 or so in Florida, there was a case where some patient apparently got AIDS from a dentist. It's still today not proven, but what really happened is that the dental profession and the other medical profession really beefed up their sterilization. So whether it is true or not, the patient did benefit, because how can he get hurt by more sterilization, right?
Absolutely.
So in this case here, let's just, whether it's true or not, but it's a big risk to take if it is true. What about people, who have that problem? Because usually they start using adhesives if their dentures start getting wiggle-woggly. They start not fitting so well. What about if they start taking what I call the hybrid denture, the implant-supported denture? Would that eliminate the need for adhesives, period, at any given time, and then just you don't have to worry about it, and it doesn't even cost all that much?
Absolutely. That is the main option. That is the main thing right now that's going. When patients is unhappy about putting adhesives in their dentures, then the second option would be to get an implant-supported denture, and basically there's no longer any need for any adhesives, and basically the denture snaps right on the implants.
And because I don't know, thanks God I never had to do that, but that adhesive stuff, even if it isn't dangerous, it couldn't be all that comfortable. Now, then there is the fact that, let me ask you, if a person gets a implant-supported denture, whether it's 2 implants or 3, depends on whatever he might need. But now let's say the minimum, in order to keep probably the price down, because that's probably why he has dentures and not full implants in the first place, to keep the price down, right? To a certain degree. Yeah. So let's say the person gets that couple of implants, 2 or 3, whatever is needed. What is the functionality of that denture, which is implant supported, versus the denture which is not, in terms of biting an apple, chewing out a spare rib? What difference do we have there? Do we have a significant difference there?
Huge difference. Let's think about it. A denture that is not implant supported is just resting on your gums. So your gums move, your tissue in your mouth is moving, so it's not going to be very stable. It can fall. When you speak, it can even fall. When you get an implant supported denture, that is eliminated 100%, because the denture snaps into a few studs, implants, and it's secured in place. Therefore, it becomes not movable.
Okay, so basically it's much stronger. You can eat better now again.
Yes, and enjoy your food much better. You don't have to worry about your denture falling out or putting glue or any of these things.
Right. Because there's more, have you noticed that some patients who get dentures, let's say they're not really all that old, they're not really looking all that bad, and they get dentures, and automatically their confidence level goes down, because all they see is grandma's dentures, and they go, I'm old, I'm done. So when they have that implants embedded, and when they can buy it, and when they feel almost no difference, that they feel more confident and overall better?
Absolutely. They chew better. They enjoy their food more. They're more outgoing. Just their confidence just starts to feel, because now you don't have to worry about your denture falling out of your mouth if you smile or you talk, which is usually a lot of the complaints when you hear that from patients that wear the glue, because eventually, even with glue, your denture becomes, over years, your jaw shrinks and it becomes looser, so they tend to fall out. And I'm sure denture patients understand what I'm talking about. So having the implants basically secures them in place, and the need for glue and is no longer.
And the feeling, even if they don't really fall out, but the feeling of falling out, is gone. And you said enjoy the food better. I mean, that probably maybe is towards biting it, but also on a denture you have that plastic or that metal liner over your palate, so you really can't taste food anymore, because that's really where you taste the food more than with the tongue. And does the implant-supported denture, is it able to take that plastic over the palate out and you can taste food again?
Yeah, the reason that plastic is in the palate is because it allows for suction. And since we have implants, that suction is no longer needed because it's supported by the implants. So the suction is really just coming from the implants. So then the roof of your mouth is exposed, where you can basically, touch the roof of your mouth with tongue and food, and you can enjoy your food much better, because then your buds are all exposed and you can feel more normal again.
Beautiful. Now, you also said, the gum shrinking. One of the reasons dentures stop fitting after a while is not necessarily because they get bad, it's because the gums and the bones are basically shrinking and the dentures stay the same. It's almost like if you lose weight, your trousers stays the same, but you're losing weight. So when you have implants, I've heard that when you lose a tooth, your gums start shrinking, which is one of the reasons you start looking like a dried out tomato, like grandma looks. And when you have an implant in it, which is a titanium screw basically, and replaces the tooth, the bone feels like there is a tooth there and then does not shrink anymore, so you don't start looking like a dried out tomato. Is there some value to what I just said, or is that hearsay?
Absolutely. Yeah, when we extract teeth, when we lose our teeth, our bone tends to shrink. When you put the implant there, you're basically making the bone that surrounds the implant think that there's a tooth structure there, and then you maintain that bone level, therefore keeping you look much younger.
Okay, so all those benefits are there with, not the cost of a full roundhouse of implants, which can get expensive, with no doubt. So it's a tremendously lesser cost, and yet you come pretty close to having a wonderful, great eating experience again. So it looks like a win-win situation, and you don't need to worry whether the rumor about the adhesive is right or not. Thank you very much for explaining this to us, Dr. Zaibak. Bye-bye.
Thank you.